We are back answering your questions with Guilford County Schools Superintendent Dr. Sharon Contreras, Chief of Staff Dr. Nora Carr, and Guilford County Health Director Dr. Julia Van. All right, so we are continuing with our text questions. I am going to be able to speak to Dr. Contreras better if I face her, so I want you to know, for those of you at home, why I am not facing you when I'm asking this specific question. Dr. Contreras, we have several frustrated parents. And I know you even said you were frustrated with all the work that had been done and you did not get to go to school. So the parent is asking, why couldn't have all this been settled 7 months ago?
That's a great question. And as you said, I'm frustrated as well. I'm a parent as well, and I want my child back in school. However, we don't control the metrics and how quickly the virus is spreading in this community. We all own that. We have very detailed plans that many districts across the country have used as a model. Plans that other districts in the state have used, but we cannot account for or control if the virus is not controlled within Guilford County. That's the one factor that we cannot own. And until we get a handle on that, children will not be able to attend school. And for those who say, well, children do not contract the virus in the same way adults do, that's true. But children are not the only individuals in schools. Teachers are in schools, school nutrition workers, custodians. There are many, many hundreds and hundreds of adults in schools. We have 10,000 employees who are all adults who work in schools. And that's something we have to consider as well.
All right, this next question is, will we be getting weekly updates on the return process? And moving forward, will we continue to get weekly updates?
Absolutely. So we intend to provide an update on Friday, although Dr. Van has shared that she doesn't expect that the data will change much by Friday. However, we intend to provide additional updates. We also have to consider that the board at some point may say that the data has changed so little that they need to come back and consider whether or not we should just plan for a January entry. We are hopeful, however, that we will get back as soon as possible because, as I've said many times, there is irreparable damage being done by students not being in school. There's learning loss, there are mental health concerns that we have to consider. So it would be my preference and many of the board members' preference that we get back to school earlier rather than later. So we are hopeful that we see some changes in the data.
Well, speaking of that, this is a follow-up. Dr. Van, maybe this one is best for you to start with, and then if Dr. Contreras or Dr. Carr wants to jump in. They say, I don't understand why they waited to the last minute. The data didn't seem to change as much. So maybe you can kind of clarify and give some more ideas to why this data that you saw the last 24 or 48 hours made such an impact on you.
Yes, sure, absolutely. And I can understand how it can be extremely confusing and frustrating at the same time when decisions are made so fast. But that's exactly what we've have to adapt to for the last 7 months, going back to that question that was asked before, that has been such a transition and we've had to pivot so many times depending on what the challenge has been and the challenges that we've had to be faced with. One of the things that we've done in the last few days is looking at the data in a rolling fashion, in a live fashion, making sure that we're not just looking at just a slice of data just for that one day, but as the cases are coming in, that data is being analyzed all the time. So that's what we've noticed, the 10 days consecutive red zones, red categories for the incidence. The positivity rate has been going up, but that was just one of the metrics. And as we've seen, and as we've said before, we're looking at all of them together as a whole. And once the incidence rate, which is the number of new cases, had shown an upward trend in 10 consecutive days, that's when the alarm was raised, and that's when we wanted to reach out to the superintendent. We've seen the numbers going up. However, we wanted to make sure that that was not a uptick in the cases, and then after just a couple of days, those are going to go down. But once it reached that 10-day consecutive day numbers, that's when we wanted to reach out to the superintendent and discuss this with her.
Thank you for clarifying. This person says, when we go back, will we only close schools with cases, or will the entire county close? Dr. Carr?
I can take that. Yes, I can take that question. Our goal is to primarily just close the area that is affected. So we'd prefer to only close a classroom if needed. That's why we are breaking our elementary schools into small groups of students so they stay together, with the idea being that you might be able to shut down a classroom, maybe do some additional cleaning, but not have to shut down an entire school. You might have to, depending on the level of cases in a school, you might have to shut down a school building or a wing of a building, but would prefer not to shut down multiple schools, but take it on a case-by-case basis within each school.
Okay, and I just wanted to, we're going to be going to break very quickly, and then you'll be able to text more of your questions, but I did want you to hear this text that just came through. Not a question, but just wanted to say thanks for your diligence in protecting our children. It's difficult for all of us, but we will get through it. So I know that there's frustration on both sides, but there's also some other parents that are understanding your frustration as well. All right, we want to continue to take your questions. Make sure you text us your questions and don't call. We'll be right back.